The coronavirus disease, universally known as COVID-19, rapidly altered the entire global structure in entirely unexpected and profound ways. This video will systematically explore what this disease is, pinpoint its documented geographic origin, detail the primary means of its human transmission, list the common symptoms, review standard diagnostic tests, cover current treatment pathways, and outline essential prevention measures. COVID-19 is specifically caused by a novel virus that researchers have named SARS-CoV-2. This particular pathogen belongs to the broad family of viruses we recognize as coronaviruses, many of which naturally circulate within animal populations before occasionally adapting to infect humans. It is vital to clearly distinguish that COVID-19 is strictly a viral illness, meaning it does not share characteristics with bacterial infections. The first documented instances of widespread human infection with this novel coronavirus were officially reported in the final month of 2019 within the city of Wuhan, located in China's Hubei province. Early epidemiological analyses strongly connected the initial human outbreaks to the activity occurring within a local marketplace that traded in both fresh seafood and various live captive animals. While numerous international scientific consortia continue their intensive efforts to fully map out the precise zoonotic route, there is absolutely no verified scientific evidence to support the theory that COVID-19 was intentionally created or maliciously released as a weaponized biological agent. The official status of COVID-19 was indeed elevated to that of a global pandemic due to its swift and expansive international spread. In March 2020, the World Health Organization made this formal declaration after observing the virus establish itself across numerous countries, ultimately affecting millions of people worldwide. The most common pathway for COVID-19 infection involves inhaling respiratory droplets that become aerosolized when an infected person coughs, sneezes, or even speaks loudly nearby. Close, unprotected physical proximity to a currently infected individual also presents a very high risk for viral transmission to others nearby. Transmission can also occur indirectly if one touches a surface contaminated with viral residue and then touches their own mouth, nose, or eyes without first washing their hands. Once successfully introduced, the virus predictably targets the upper and lower respiratory tract tissues for active replication and proliferation within the host. Symptoms associated with this illness present across a very wide clinical spectrum, ranging from being completely asymptomatic to developing severe, life-threatening respiratory complications. The typical onset window for symptoms to first appear after exposure is generally observed to be between 2 and 14 days following initial contact. Frequent signs that signal a possible infection include experiencing a fever or persistent chills, a new continuous cough, generalized body fatigue, and frequently a noticeable reduction or total loss of the senses of taste and smell. In the most serious documented instances, patients exhibit significant difficulty breathing that necessitates immediate emergency medical stabilization and respiratory support. Confirming a COVID-19 diagnosis requires specific laboratory analysis to detect the presence of the active virus or its components within a patient sample. The highly accurate RT-PCR test remains the benchmark method because it successfully identifies the virus's unique genetic blueprint with high precision. Alternatively, the rapid antigen test offers much quicker feedback, making it a useful screening tool for immediate results in various settings. Both testing methods conventionally rely on carefully collecting biological material, using a specialized swab inserted into the throat or nasal cavity. It is important to understand there is no single pharmacological agent that acts as a definitive universal cure for eliminating the COVID-19 virus once a person is infected. Current therapeutic interventions focus instead on expertly managing the patient's evolving symptoms while supporting essential bodily functions until the immune system achieves clearance. For most non-hospitalized individuals, treatment protocols emphasize simple supportive care, including plenty of rest, consistent fluid intake, and taking fever-reducing pain relievers as needed. Certain antiviral medications are specifically reserved for those identified as being at higher risk for developing severe, complicated disease progression. In acute hospital scenarios involving respiratory compromise, providing supplemental oxygen is a critical component of life-saving care. The amount of time required for a full physical return to pre-illness health level varies considerably depending on the initial severity of the diagnosed COVID-19 case. Patients with mild infections typically report that all residual symptoms have cleared up within 1 to 2 weeks of their initial onset. However, those who experienced more severe forms of the illness may require a recovery period stretching across several weeks or even multiple months to fully regain their baseline energy levels. Widespread vaccination adoption, combined with swift access to effective early medical intervention, dramatically increases the probability of a successful and rapid recovery for nearly everyone. Adopting a layered strategy involving several key protective behaviors is undeniably the strongest defense mechanism against widespread community transmission of the virus. The single most effective public health measure recognized globally is ensuring full compliance with recommended vaccination schedules, including all authorized booster doses. Frequent and thorough hand washing with soap and water, especially after touching high-contact surfaces, must be prioritized throughout the day. Wearing a well-fitted protective face covering inside crowded indoor venues significantly reduces the inhalation risk from contagious airborne particles. Practicing excellent respiratory hygiene by covering all coughs and sneezes away from others is another essential element of community protection. Simply put, consistent application of these practical precautions is what ultimately contributes to saving lives on a broad population scale. The entire experience with COVID-19 served as a powerful, sobering demonstration of how intricately linked our modern, interconnected world truly remains. By continually advancing scientific understanding, promoting broad public health literacy, and encouraging responsible individual actions, humanity persistently continues its unified struggle to effectively manage and ultimately recover from this unparalleled global crisis. Therefore, please make a conscious effort to stay reliably informed using credible sources. Always prioritize maintaining your personal safety and the safety of your immediate community members. Take deliberate care in your daily interactions moving forward.